Stop ignoring the warning signs your body is desperately trying to send you. Every single year, nearly 800,000 Americans suffer a stroke, and here is the part that will shock you: the majority of them had clear, unmistakable warning signals in the 72 hours before it happened. They just didn't know what they were looking at. Today, I'm going to change that for you. I've spent over 25 years in neurology and vascular medicine, and what I'm about to share with you is the information that could genuinely save your life or the life of someone you love. A landmark study published by the American Stroke Association followed over 2,400 stroke patients and found that 43% of them reported experiencing at least one significant neurological warning symptom in the 3 days before their stroke, and they dismissed it. They thought it was tiredness, stress, getting older. That stops today. And stay with me, because warning sign number 1 on this list is something that nearly every person over the age of 65 has experienced in the past month, and almost no one connects it to stroke risk. It is that overlooked and that dangerous. But before we dive in, I want to ask you something directly. Tell me in the comments below, how old are you, and have you or someone you love ever experienced a sudden symptom that seemed strange and then disappeared? I personally read every single comment on this channel, and your answer genuinely helps me understand what content to bring you next. This community matters to me deeply. Now, we're counting down from 6 to 1 from the warning signs that are commonly missed to the one that doctors consider the most critical red flag of all. Let's begin. Warning sign number 6, sudden and unexplained fatigue that feels different from ordinary tiredness. This is not the kind of tired you feel after a long day of gardening or a poor night's sleep. This is a fatigue that drops on you like a weighted blanket out of nowhere in the middle of the afternoon while you're sitting still, while you're doing absolutely nothing strenuous. It feels wrong, and somewhere inside you know it feels wrong. Here's what's happening beneath the surface. Researchers at Johns Hopkins University studied pre-stroke fatigue patterns in adults over 60 and found that sudden onset unexplained fatigue in the 48 to 72 hours before a stroke occurred in approximately 38% of cases, particularly in women, where it's often the primary presenting symptom and therefore the most frequently misdiagnosed. Think of your brain like a city and your blood vessels like the highway system moving traffic through it. When one of those highways starts to narrow due to a clot forming or a vessel beginning to spasm, traffic slows. Different regions of the brain start receiving less oxygen and less glucose. The brain is an extraordinarily energy-hungry organ, consuming roughly 20% of your body's total energy, despite being only 2% of your body weight. When supply starts dropping, the first thing your brain does is pull resources from non-essential systems. You feel it as an overwhelming, sudden need to rest. After the age of 70, your cerebrovascular reserve, your brain's ability to reroute blood flow when one vessel is compromised, is already reduced by as much as 40% compared to a 40-year-old. That means the early warning system fires faster, but it also means there is less time to act. What you should do: keep a simple daily energy log. You don't need an app, just a notepad beside your bed. Rate your energy 1 to 10 every morning and evening. If you experience 2 or more episodes of sudden, unexplainable fatigue, not sleepiness, but that heavy, strange exhaustion within a 72-hour window, contact your doctor that day. Do not wait. Pair this with adequate hydration, because even mild dehydration thickens the blood and accelerates clot formation. 8 glasses of water daily is not optional for anyone over 65. Warning sign number 5, hiccups that won't stop, combined with chest discomfort. I know what you're thinking. Hiccups? For stroke risk? Stay with me, because this one surprises almost everyone, and it has a very specific neurological explanation. The vagus nerve and the phrenic nerve, which control the diaphragm and hiccup reflex, share neurological pathways with the brainstem, one of the most stroke-vulnerable areas of the brain. When circulation to the posterior part of the brain is being compromised, these nerves can misfire. A study from the Stroke Journal, published through the American Heart Association, documented cases where persistent hiccuping lasting more than 5 minutes combined with even mild chest pressure or upper back pain was a precursor to posterior circulation stroke in patients over 65 in approximately 1 in 8 cases reviewed. This particular stroke type, called a posterior circulation stroke or vertebrobasilar stroke, affects your balance, vision, swallowing, and coordination. It is also, critically, one of the most commonly missed strokes in emergency departments because the symptoms don't always look the way people expect a stroke to look. Margaret, a 71-year-old retired librarian from Savannah, Georgia, came to our clinic after a hospitalization. She told me she'd had persistent hiccups for nearly half a day the week before her stroke and a strange ache between her shoulder blades. She'd assumed it was something she ate. Understanding what those symptoms meant could have gotten her to the ER 12 hours earlier. If you are over 65 and you experience hiccups lasting more than 10 minutes alongside any discomfort in your chest, back, or jaw, treat it as an emergency. These are not digestive symptoms. This is your brainstem asking for help. Warning sign number 4, sudden temporary vision changes in one or both eyes. This is where things become absolutely critical, and I need you to pay very close attention. One of the most significant pre-stroke warning signs is called a transient visual disturbance, and it can feel like someone briefly dimmed the lights, like a gray curtain pulled across one eye, or like a sudden blurring or doubling of vision that resolves within minutes. The medical term for the temporary loss of vision in one eye is amaurosis fugax, which sounds complicated but translates simply to fleeting blindness. It occurs when a tiny clot or piece of arterial plaque temporarily blocks the central retinal artery, a vessel that shares its origin with the main blood supply to the brain. Researchers at the University of Oxford's Stroke Prevention Unit found that patients who experienced amaurosis fugax had a 20 to 25% risk of full ischemic stroke within the following 72 hours if left untreated. 20 to 25%. Within 3 days. After age 65, the carotid arteries, the two large vessels running up either side of your neck, have typically accumulated decades of inflammatory plaque. This is the aging process at work. Chronic low-grade inflammation, which researchers now call inflammaging, accelerates arterial stiffening and makes these arteries increasingly vulnerable to the kind of turbulent blood flow that dislodges plaque fragments. When one of those fragments travels upward, the eye is often the first place it lands. This is the symptom I urge you to treat as a 5-alarm emergency. Do not drive yourself. Do not wait to see if it happens again. If you experience any sudden change in vision, even if it fully resolves in 3 minutes, call emergency services immediately. This is a medical emergency that requires imaging within hours, not days. Scientific references are linked in the description below. Now, if this channel has ever helped you or someone you love understand their health better, this is the moment I'd ask you to hit that subscribe button and give this video a like. I don't have a pharmaceutical sponsor. I don't have a hospital system paying for this content. What keeps this channel going is you, this community of people who believe that understanding your own body is a fundamental right. Subscribe now and turn on notifications so you never miss a video that could matter this much. Warning sign number 3, sudden severe headache with no known cause. Doctors call this the Thunderclap headache, and the name is exactly right. This is not a tension headache. It is not a headache that builds gradually. This is a headache that arrives at maximum intensity in 60 seconds or less, like a thunderclap out of a clear sky. Many patients describe it as the worst headache of their life. This type of headache is the hallmark warning of a subarachnoid hemorrhage, a type of stroke caused by bleeding around the brain, and it is a neurological emergency without exception. Research from the Mayo Clinic's neurovascular unit found that patients who reached the emergency department within 3 hours of thunderclap headache onset had a survival and recovery rate nearly 60% higher than those who delayed care beyond 6 hours. But there is also a subtler version of this warning that affects the pre-stroke window more broadly. Researchers from the Karolinska Institute in Sweden analyzed the pre-stroke headache patterns of over 1,800 patients and found that 29% reported an unusual, unfamiliar headache, not necessarily thunderclap, but strange and different from their normal pattern in the 48 hours before their stroke. These headaches were often located at the back of the head or behind one eye, and they were frequently accompanied by neck stiffness. Robert, a 78-year-old former electrician from Cleveland, Ohio, told his daughter he had a weird pressure behind his right eye for 2 days before his stroke. He took ibuprofen and went to sleep early both nights. He survived, but he spent 4 months in rehabilitation. He told me afterward, "If I'd known what that feeling meant, I would have gone to the hospital immediately." Here is what you need to do. Know your own headache patterns intimately. If you experience a headache that is new in character, location, or intensity, one that feels like nothing you've had before, that is a medical red flag. If it comes on suddenly at full intensity, it is an emergency call. Do not take pain relievers and go to sleep. Call for help. Warning sign number 2, sudden confusion, unusual word difficulty, or feeling mentally foggy in a new way. This is the one that is missed more often than almost any other, particularly in older adults, because we have been culturally conditioned to accept cognitive fogginess as a normal part of aging. It is not. Sudden onset is the critical word here. When a stroke is forming when blood flow to the language centers of the brain or to the frontal lobes responsible for processing and decision-making begins to drop, the first symptom can be a strange difficulty finding the right word. You reach for a word you've used 10,000 times and it simply isn't there. You might substitute a wrong word without realizing it. You might lose track of what you were saying mid-sentence. You might feel a sudden, disorienting mental fog unlike anything you'd describe as ordinary forgetfulness. A collaborative study between Stanford Medical Center and the University of California, San Francisco followed 1,100 adults over 65 who later suffered ischemic strokes and found that 34% reported a sudden episode of unusual confusion or word-finding difficulty in the 72 hours preceding the stroke, an episode they had attributed to fatigue, stress, or simply getting older. Here is the neuroscience. After age 75, the brain's white matter, the network of communication pathways between different regions, has already experienced measurable decline. Even a very temporary reduction in blood flow to these pathways can produce striking cognitive symptoms. Think of white matter like the fiber optic cables connecting different parts of a computer. When the power supply to those cables flickers, the whole system stutters. Dorothy, a 74-year-old retired school principal from Portland, Oregon, told her husband she felt scrambled for about 20 minutes. One afternoon, couldn't remember where she kept the plates, couldn't finish her sentences. They laughed it off. 14 hours later, she was in the emergency room with a left hemisphere ischemic stroke. The FAST acronym stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. But what most public health campaigns leave out is that these symptoms can present partially and briefly in the days before a major event. Even a 2-minute episode of speech difficulty is a neurological emergency. And now, warning sign number 1, the single most overlooked, most misunderstood, and in my clinical experience, most dangerous pre-stroke warning sign of all. Sudden temporary weakness or numbness on one side of the body that completely resolves. This is called a transient ischemic attack, a TIA, and it has been called a mini stroke in popular media, a term I actively dislike because the word mini implies it is minor. It is not minor. It is a 5-alarm fire in your vascular system. A TIA occurs when blood flow to part of the brain is temporarily blocked long enough to cause symptoms, but short enough that the blockage resolves on its own before permanent tissue death occurs. The symptoms can include sudden weakness or heaviness in one arm or leg, numbness or tingling on one side of the face, sudden difficulty walking or a feeling that one leg isn't cooperating, or any of the symptoms I've already described today, confusion, vision changes, headache lasting anywhere from a few minutes to a few hours, then vanishing completely. Here is the critical number you need to memorize. According to research published in the New England Journal of Medicine and confirmed by subsequent studies at Oxford's Stroke Prevention Program, approximately 10 to 15% of people who experience a TIA will have a full stroke within 3 days. Not 3 months, not 3 years. 3 days. And nearly 50% of all major strokes that follow a TIA occur within the first 48 hours. When symptoms resolve, the danger does not resolve with them. The clot or plaque that caused the TIA is still there, still unstable, still threatening. After the age of 65, the risk compounds further because arterial elasticity has declined significantly, inflammatory markers are chronically elevated, and the brain's ability to recover from repeated small vascular insults diminishes with each passing year. The same event that might produce a warning in a 55-year-old produces a full stroke in a 75-year-old. Thomas, a 69-year-old retired engineer from Phoenix, Arizona, woke up one morning and noticed his right hand felt strange, numb, and slightly weak. He dropped his coffee cup. He sat down, and 15 minutes later, the feeling had completely resolved. He felt completely normal. He drove to the hardware store. He came home. He made lunch. 6 hours later, his wife found him on the kitchen floor, unable to speak. He had suffered a massive left hemisphere stroke. Thomas spent 9 months in rehabilitation. He regained much of his speech and movement, but his independence was changed permanently. He has given me permission to share his story here, and he asked me personally to tell as many people as possible. When the warning comes, you go to the hospital immediately. Even if it passes, especially if it passes. If you or someone near you experiences any one-sided weakness, numbness, facial drooping, sudden vision change, inability to find words, or loss of coordination even for 3 minutes, even if it completely resolves, you call emergency services. You do not drive. You do not take a nap. You call for help. Time is brain, as we say in neurology. Every minute a stroke is progressing, nearly 2 million neurons are being lost. Speed is the single most powerful factor determining recovery outcomes. Here's what I want you to take away from everything we've covered today. Your body does not abandon you without warning. It speaks to you sometimes loudly, sometimes in whispers, and the only thing standing between a warning and a tragedy is knowing the language. The 6 signs we covered today, that strange fatigue, the persistent hiccups with discomfort, the visual changes, the thunderclap or unusual headache, the sudden confusion or word difficulty, and most critically, the one-sided weakness or numbness that resolves on its own, these are your body's distress signals. They are not aging. They are not stress. They are not something to sleep off. You have spent decades building a life, a family, memories, a home full of meaning. The quality of the years ahead of you depends on the decisions you make in moments like the ones we talked about today. I have seen patients in their 70s and 80s who caught these warnings in time and walked out of the hospital unchanged. I have also sat with families in waiting rooms. The difference between those two outcomes is often simply knowing what to look for. It is never too late to protect yourself. It is never too late to pay attention. And it is never too late to share information that might save someone's life. If this video helped you today, please subscribe to this channel and share this video with one person over 60 in your life, a parent, a friend, a neighbor, a sibling. You may not know it, but that share could be the most important thing you do today. Hit the bell icon so you're notified every time I release new content, because next week we're covering the 5 foods that actively protect your brain's blood vessels after 65, and the results from recent research are extraordinary. And tell me in the comments, which of these 6 warning signs surprised you most? And have you or someone close to you ever experienced something that might have been a TIA that was dismissed at the time? I read every comment, every single one. And this conversation matters. Your health is worth fighting for. I'll see you in the next video.